So we are seeing a huge surge in the number of cases, and this has really gone up exponentially, causing a huge strain on the healthcare system. I think the cause for this is actually multifactorial, but I think the two main causes that one is that in January and February, when the vaccine started being used and cases came down, a lot of people felt that COVID is over and felt that they did not need to have COVID appropriate behavior. People stopped wearing masks, people started having parties, and there was a lot of get togethers and marriage functions because of the fact that all of them had been put on hold for a long time, for almost a year. Now, the virus was still around, and therefore, this gave an opportunity for the virus to spread itself rapidly. I also feel that at that point in time, unfortunately for us, the virus did mutate. A new strain was there in India, which was more infectious. It was able to spread more rapidly among people than what it was doing 6-7 months ago. So therefore, this led to an environment which was very conducive for the virus to spread because there was no COVID appropriate behavior. The virus could spread rapidly in our community in special areas like we saw in Maharashtra and certain states to a large number of people because of crowding. And this led to a huge surge which happened in a very short span of time. The curve is very steep, suggesting that these two factors led to a huge increase in the number of cases in a very few days rather than weeks or months that we had seen last time. 2 or 3 lakh people per day, then the number of people who require hospital care proportionally goes up. And also, if one person is admitted in a hospital, he's going to be there for 5, 7, 10 days. So your hospital bed gets blocked. And if you continue to have more and more people coming in, you will run out of hospital beds. Therefore, I think we have to have a multi-pronged attack. We have to keep increasing our hospital beds and resources for the increasing number of cases that we're seeing. But we also need to work aggressively on decreasing the number of cases because no health system will be able to manage so many patients. And we will have a huge crisis in terms of patient management. And doctors already are sort of overburdened. They've been working for more than a year and other healthcare workers. So this is something that we need to really think about, that we have to urgently bring down the number of cases. And therefore, we must work aggressively on trying to see how we can bring down the number of cases, either develop containment zones, containment areas where your positivity rate is high. You do a lot of testing, tracking, treating, and isolation. You don't allow people from that area to go out and spread the disease, and therefore go back to all the strategies that we were following 6-7 months ago to decrease the number of cases.
हमने की गलती फिर एक बार, कोरोना ने किया दोबारा प्रहार। मास्क, 2 गज दूरी, करें अपनी सुरक्षा पूरी। कोरोना टीका हम सबको लगाना है, मिलकर साथ समझदारी से कोरोना को हराना है।